How changes can be made in a millimeter。让我们来欢迎义大医院，也是我们本团团长、减重权威的蔡明宪部长为我们分享改变在毫米之间，掌声欢迎。
Ladies and gentlemen, distinguished guests, I'm Dr. Tsai on behalf of this our group and also on behalf of Ida Hospital. We are very thankful for your coming here to hear how we are present our medical services advancement in Taiwan. So first of all, I would like to share our experience, medical experience in Ida Hospital, which is regarding weight loss. My topic is this. My topic is how we can change a person's life by a very powerful, durable weight loss surgery, which is also known as bariatric surgery. And we made this surgery through very tiny incisions, so change actually can be made in a millimeter. Okay. So first of all, I would like to briefly introduce my hospital, which is Ida Hospital. We are located in southern Taiwan, in Kaohsiung City. In Kaohsiung City specifically, we have 1,000 beds, more than 1,000 beds actually, which means this is a very huge hospital containing many subspecialties. We provide every cutting-edge medical technology in every field. We are very close to the airport, international airport, which means we are very convenient for foreign customers or patients. Okay, this is our hospital. You can see this is a very humongous building provide every advanced technology. And we are also a JCI accredited hospital, so we have accredited by JCI several times, at least 3 times, and now we are the fourth accreditation is coming in next month. Okay, regarding myself, I'm now holding the position of supervisor of Department of Surgery in Ida Hospital. My main field is bariatric surgery, which I learned from US and also from Europe. I've been visiting a very famous bariatric centers in both Europe and US for learning bariatric surgery. So what is bariatric surgery? Let's see this. I would like to introduce bariatric surgery by using this short video clip. This video clip actually is authorized by American Society of Bariatric and Metabolic Surgery. They kindly agree me to use this video clip to introduce bariatric surgery to Taiwanese people. So I put Chinese and English subtitles on it so that even who cannot understand English can understand what is bariatric surgery.
Bariatric surgery. You probably think it's an extreme solution for people who end up on TV shows like My 600-Pound Life, right? Did you know the typical bariatric surgery patient is a woman between the ages of 35 and 50 and is about 100 pounds overweight? Not extreme at all. Take Sarah, for example. She's a 45-year-old wife and mom of 3 kids. She's 5'5" and weighs 245 pounds. That means her body mass index, or BMI, is 41. That's too high. In fact, anyone with a BMI over 30 has the disease of obesity. Sarah's parents were heavy, and she has always been bigger than her friends. But in the last few years, she has steadily gained weight despite her best efforts. Oh, by the way, she takes medicine for high blood pressure, was just diagnosed with sleep apnea, and her doctor told her she has pre-diabetes. She goes to the gym 2 or 3 times a week and eats a pretty healthy diet, but her weight is now out of control. Sarah wants to be slimmer, but like most Americans, she thinks it's a willpower problem. She has always quietly fought this battle on her own, but is now at her wit's end. The straw that broke the camel's back was when she was too big to get on the roller coaster last summer with her kids. What Sarah doesn't know is that in addition to the frustration she feels about her weight, obesity has put her on a path towards heart disease, type 2 diabetes, and many other life-threatening chronic diseases. Most people think of obesity as a defect of character. People with obesity are often looked at as lazy and undisciplined. That's not the case for other chronic diseases, though, and it shouldn't be the case for obesity. Like cancer or heart disease, obesity is a combination of environment, genetic, and lifestyle factors, and left untreated, it's deadly. Sarah doesn't want to drag her feet until she develops diabetes, has a stroke or heart attack, or worse. So she takes action and asks her doctor to help her find effective treatment. Once she realizes how much her weight is putting her health and future at risk, she considers having bariatric surgery. Sarah's bariatric surgery team talks to her about two options: sleeve gastrectomy and gastric bypass. Both procedures decrease hunger and improve feelings of fullness when eating by decreasing stomach size, changing hormones released by the gut, and altering the way Sarah's stomach talks to her brain. Unlike dieting, Sarah's body won't fight back when she rapidly loses weight after bariatric surgery. Over time, her body will find a much lower and a much healthier set point for her weight that she can maintain. After talking with her surgeon, Sarah chooses to have a sleeve gastrectomy. The surgery is done laparoscopically with a few small incisions, takes about an hour to complete, and she spends one night in the hospital before starting her new life. 1 year after surgery, Sarah has lost 90 pounds. She no longer takes blood pressure medicine or uses her CPAP device, and her blood sugar is normal. She feels great and still exercises 3 times a week, but can do a lot more in the gym now. She still eats a healthy diet, but her portions are smaller than before. She knows she has to work hard to maintain her weight now, but she has the tools to do it. Most importantly, she has tons of energy to play with her kids and is back to riding that roller coaster. While there are extreme examples of obesity on TV shows, most bariatric surgery patients are a lot like you or someone you know. Regular people who have struggled with their weight for too long. There is safe and effective treatment for obesity, and it's not extreme. Join the 200,000 Americans who take control of their health each year by undergoing bariatric surgery. Obesity can be effectively treated, but you have to ask for help. Ask your doctor to refer you for a consultation to a bariatric surgery program, or find a bariatric surgeon in your area by using this link.
Okay, so this is a typical American case receiving bariatric surgery. In our experience, not especially, in Asian experience, we have similar experience. So, which later I will show you our experience. So, So we know what bariatric surgery can help people with obesity problem or obesity disease. And obesity is considered as a disease because it is a life-threatening condition. And chronically, it can dramatically shorten people's life. So, so that's why I decided to learn this kind of technique and this kind of medical service to help people. But let's talk about the safety and effectiveness. So the safety is always among our main consideration for our patients or for our customers. As I mentioned before, I learned this technique from America and from Europe. So we adopt and improve actually their protocols. So after I start to supervise this medical service, I strictly require every member to, follow our current protocols. And with adopting our current protocols, we are able to create a very, very safe procedure and services for our patients. Actually, in the past 2 years, no, not 2 years, in the past 1 year, we have already achieved a milestone, which means no complication in more than 225 consecutive bariatric cases. This safety is, a very, very high standard for every bariatric patient. Actually, if you look the literature, the average complication rate is around 5%. It's already very, very low. But in our hands, the complication can be as low as 0. And more than 95% of our cases can leave the hospital within 1 or 2 days after the surgery. So we are also accredited as one of the outstanding bariatric surgery centers in Taiwan, just received this year. And we are also able to present our results and our safety guidelines and protocols in many different professional medical societies conferences. And we can also use very cutting edge technology, including robotic surgery, to do this kind of surgery. Actually, we did this kind of surgery in many very high-risk patients with heart problem, with very old age patients. We can still do this procedure safely. So let's see some picture. We talked about the safety, and now I'm going to talk about the effectiveness of this procedure. We just saw this short video clip, and this is one of my patients who was weighed 171 kilogram originally. Okay, that's him 8 months ago, and he received laparoscopic sleeve gastrectomy, and now she weighed only one half of his original weight, and he become very heavy. This gentleman, he's a very high-risk patient. Actually, his heart is kind of failing process, which means he cannot tolerate exercise because of his body weight problem. So we did our team, actually, including myself, including our nurse, including our anesthesiologist, including our heart doctors, work together to help him lose 54 kilograms in 1 year. So that's how he looks right now. And this lady is another case. She cannot find a job because every employer, when she looks like this one, every employer didn't want to hire her because they have so-called stereotype images. But we did a successful surgery for her. So that's how she looks right now, and you can see her smile on face. So this procedure actually dramatically changed people's lives. So in the end, I would like to thank everyone for coming here, and I would also like to thank my team and also all these patients, and which including many foreign patients coming from either mainland China, Hong Kong, Malaysia, Indonesia, Australia, England. So I would like to thank their trust and our team member. And if you are interested in more, actually we have more information which are listed in the website. Our website is audiocut.net, and you can also approach us through Line or WeChat. We have ID on that. So that's all my presentation today. Thank you.
谢谢蔡局长 Thank you to the Chinese Medical Hospital for sharing with us about that impressive